Hello, I am Dr. Mark Stickney. Welcome to Ask the Vet Live, presented by Good Charlie Energy. We are going to answer questions that you have today. We are going to talk about things that are happening with Spay Neuter Network and things that are happening in the lives of pets across the world. As we go along here, please feel free to ask me your questions live if you're watching this live, and I will address them as they come in. In the meantime, let's jump right into some questions that I have received already through email. So, Jason has written in he says that my cat has always been good about using the litter box, but recently she's been peeing just outside of it instead of inside of it. I haven't changed the litter, the box location, or my cleaning routine. She doesn't seem stressed otherwise, which makes it confusing. I'm not sure if this is behavioral or if it could be a medical issue like a urinary problem. Well, Jason, that is a great question, and there are few things as frustrating to figure out as when a cat is not using the litter box. It sounds like you have checked off the most common things, that the litter is being kept clean, the box is in the same place, you're using your same cleaning routine. I'm going to assume you are still using the same cat litter that you have always used. Cats can be very picky about that. A couple of things from a behavior standpoint to think about are that if you have any new pets in the house or have had company come over or anything like that that is new in the environment, that can upset a cat. Another thing to think about is if there is a window that your cat is able to look out of and there is a new cat outside roaming around and looking inside the window, that can throw off some cats as well. I don't know how many litter boxes you have, but the general recommendation is that you should have one more litter box than you do cats. So if you have one cat, you would want to have two litter boxes in two different locations of the house. Now, those are some behavioral things that could be going on. You're absolutely right that this also could be a medical issue. A urinary problem would certainly be one of those. There also could be sometimes when cats are starting to develop some kidney disease or liver disease, those can also be reasons that they will also stop using the litter box normally, as well as some endocrine diseases. So it would be a great idea to take your cat into your regular veterinarian and have them check a urinalysis and check some blood work. And they'll be looking for any changes in the urine that would indicate renal disease or crystal formation. They'll be looking at any changes in their blood work to see if they see any abnormalities there. And those could also be an explanation for what's going on. So as I said, these are sometimes not the easiest things to sort out. It sounds like you are on the right track. Definitely getting your cat checked out would be a wise move at this point to see what else is going on, especially since nothing else has changed. Okay, another question from Veronica. Veronica writes in and she says, I have a 12-year-old cat named Luna, and over the last few months she's just been sleeping a lot more than she used to. She still eats, drinks, and uses a litter box like normal, so part of me feels like silly worrying, but she used to follow me everywhere, and now she mostly stays in one spot. I can't tell if this is just her slowing down with age or if something could be wrong. How do you usually tell the difference between normal aging and an early health issue in cats? Okay, those are all good questions. There's a lot going on there. The first thing that I would say, Veronica, is that if you think there is something going on with your pet, don't feel silly about it, because you see them every single day and you know what is normal for them and you know what is not. So if you notice something, take that seriously. You're not being silly to point it out. Absolutely, cats get older, and we typically will say that a pet is a senior at 7. So your cat is definitely in the old age range. It is great that she's still doing all of her regular stuff, but she also is starting to slow down a little bit. So normal aging often is what people consider to be, quote, normal aging changes is often the start of early health issues. A couple of things that cats will commonly get as they become older are kidney disease and arthritis. Arthritis is something that tends to be underdiagnosed in cats because cats are very good at hiding when they are sore and stiff and not moving as well versus dogs. You can tell right away when a dog is limping most of the time. But cats will kind of just slow down. One of the things that you'll notice a lot with a cat that has arthritis is that they no longer want to jump up on things. They tend to stay more on the ground and not be as bouncy as they once were. So I think you would be well advised to take your cat in to get checked out. Have your veterinarian do a good physical exam, especially looking at her limbs and joints and making sure that she doesn't detect any evidence of arthritis there, and check some blood work because things like kidney disease can start slowing down an older cat as well as some other problems. So getting things checked out now would be a great idea. As always, jumping on a problem sooner rather than later is always better in the long run. So I think it's great that you have noticed this change, and I think you should get that checked out to see if there is anything that we can identify as being a problem there. Great question. Mary writes in to say, my cat Leo has bad breath that doesn't seem normal, even though he still eats fine. I've looked at his teeth as best I can, but I'm not sure what I'm seeing. I know dental disease is common in cats, but I don't know how serious it can get. At what point does dental health become a medical issue rather than just bad breath? So that's a great question, and cats and dogs, unless you are the one brushing their teeth every day, their teeth is not getting brushed. So they are always getting tartar and plaque buildup on their teeth. And over time, that will result in swollen gums and gingivitis that will let things get trapped between their teeth, and that tartar will just start to develop a smell as bacteria starts to grow into it. So dental disease is definitely a reason for your cat to have bad breath. Other reasons that your cat can sometimes develop bad breath would be if they are starting to get kidney disease or if they are starting to get diabetes. So having your cat checked out by your veterinarian would be a great call here. They're going to take a look in their mouth. Some cats are better at opening their mouths than ever, but are better at opening their mouths and letting the vet look than others are, but we can probably get a little peek in there. We also can check some blood work. We can look at the kidney enzymes. We can look at the blood sugar and make sure that things are looking normal there. If we do have some dental disease going on or we need to take a better look, your veterinarian will recommend a dental procedure under anesthesia to see how those teeth look, clean them up, possibly take x-rays and see if if any teeth need to come out or anything like that. So if your cat is having bad breath for more than a couple of weeks and it's not because you just opened up a can of tuna fish for them, you should probably get that looked at. If you're noticing a change that goes on for longer than 2 weeks with their breath, have them take that cat to your veterinarian and see what is going on there. Great question. Okay, Susan writes in and says this is a question about post-spay care for a 3 to 4 month old kitten. And spaying cats and kittens, it's our big mission at Spay Neuter Network. So this is an excellent question. And Susan writes in to say, our cat, a 3 to 4 month old domestic shorthair, got spayed. About 5 minutes after getting home, she could not control her bowels and started eliminating with no ambition to reach the litter box. We tried cleaning it as best we can. She got it on her post-op onesie, and we kept a close eye on what we fed her and did. Alongside her uncontrollable bowel movement, she was not at all drowsy. She was trying to jump and play and attack her tail for several hours. It finally took me sitting in the washroom with her and waiting until she tuckered herself out for me to let her rest overnight in the washroom where she had food, water, and litter box access. We have not checked the stitches yet, but I just wanted to ask you if this is normal behavior. So that is a great question, and I will tell you, whether you are a person, a dog, or a cat, waking up from anesthesia can be a very strange sensation. And animals will do some strange, odd things from time to time. The the medications that we use for anesthesia can affect their GI tract and their bowels. Typically, it will cause them to actually be a little bit constipated and not have a bowel movement for a day or two. On the other hand, they can wake up from it kind of stressed and have diarrhea because of that. And along with that, if it's been within the first 12, 24 hours of anesthesia, everything still kind of feels funny too. So they may not even be aware of what they're doing. Some animals come home and they are drowsy and sleepy and don't really want to do anything. Some animals, especially cats sometimes, kind of are hallucinating, and they're seeing giant pink mice or whatever it is that a cat would see all over the place, and they're just kind of acting crazy and won't settle down for a while until their body is able to break down more of those anesthesia drugs. So the behavior that you are seeing is not abnormal. It is just how your particular kitten responded to surgery and to anesthesia. Um, as long as within 24 hours we are back to our regular self, eating, drinking, using the litter box, wanting to be as active as we will allow them to be, that is a good sign. So you're just experiencing some of the joys of recovery from anesthesia there. Here is a question that comes in, and the question is, why does my cat's mouth sometimes smell so bad? An excellent question, and there are a few reasons for that. One is that if this is a kitten, kittens will be losing their baby teeth and be having their adult teeth coming in for a period of several months. As that happens, those teeth get loose, and there's a little bit of bleeding as they lose some teeth, and then new teeth erupt from the gum line, and that can make their breath smell really bad as kittens. Now, if they are adult cats, remember that cats are not going to be brushing their teeth unless we are the ones doing it for them, so they can build up tartar and plaque on their teeth that can give them bad breath. Depending on what their diet is, they can temporarily have bad breath. If they have just eaten a can of tuna fish, their breath is going to smell bad. If they are eating a different diet every day, or they go outside and potentially find something to eat that is dead or dying, that can give them bad breath. And then if they are starting to develop some health problems, they can also get some bad breath. The problems that typically will cause bad breath in cats, would it be, in addition to dental disease, would be kidney disease or diabetes. So those are all possible reasons for why your cat's breath does not smell good. And I will typically say that if you notice that your cat's breath smells bad, and it's not related to something new that they ate, and it's been going on for longer than 2 weeks, it's time to get them checked out by your veterinarian to see if there's some type of dental disease going on, or if we need to check some blood work and see if there is something on the inside of their body going on. That is a great question. Thank you for asking that. Here is another question from Wendy, who writes in to say, when is it safe to get my tiny cat spayed? She says, my cat is about 9 months old now, so I think she's old enough, but my concern is that she's still very small, only 6.5 to 7 pounds. I know a couple of different people who have gotten pets fixed too soon and they passed away, so I'm just trying to be really careful about timing this right. Is it okay to spay now, or should I wait? If I should wait, is there something in particular I should watch for that would signal to me that it's okay to spay, such as her first heat? Okay, this is a great question. There's lots of things here. So first off, it is perfectly safe to anesthetize your cat at the age of 2 months of age and of 2 pounds of body weight. As long as they are otherwise healthy, that anesthesia and surgery can be safely performed on them. So your cat is older than that and heavier than that. So you're definitely above that weight range for trouble. Um, there is always a risk of complications from anesthesia and surgery, and there is nothing that can make those risks entirely go away. But at Spay Neuter Network, we are routinely spaying kittens as young as 2 months and as small as 2 pounds of age, and they do quite well. And when they wake up from surgery, they usually don't even know that anything happened. The other thing that I would say is that you would really like to have your cat spayed before her first heat cycle, because once that happens, you're going to know it's going to happen. You're going to know it's happening, and she's going to drive you crazy because she's going to be caterwauling and trying to slip out the door, or be sitting up in the windows meowing, and she will not want to leave you alone. So if you can get onto that and avoid that in the first place, that would be the ideal, and you never have to deal with those behavior changes as well, and the risk of potentially having a pregnant cat and kittens. So I would say that the time to get your cat spayed is now, and we are more than happy and able to do that here at Spay Neuter Network, and we would love to see you. Kate writes in and asks, what do I do if my cat gets fleas no matter what? I have two 4-month-old cats. We have given them numerous baths and used flea spray on them, but the fleas will always find their way back. Any advice? All right, great question. Fleas are terrible little parasites. They bite, they itch, and they spread diseases, and they are everywhere, especially in Texas, especially here here in San Antonio, we really haven't had much of a winter, but as soon as that weather starts to get moist and warm, they'll really explode. So here's the thing to remember about fleas with your cats. If you see a flea on your cat, fleas will only spend about 5% of their time actually on your pet. The rest of the time, they're hopping around in the environment laying more flea eggs. So whatever you see on your pet is just the tip of the iceberg for the fleas. So what that means is that we always have fleas in the environment. And if our cats are going outside at all, it doesn't matter how flea-free our house is, they are going to find fleas outside as well. So what we need to do is have a consistent flea control plan. Giving them flea baths is fine, and using flea spray on them is fine. The problem with that is that neither of those have a very long residual effect, which means that they don't keep killing fleas for very long after you've done it. Those treatments will kill the fleas that are on them, but it won't do anything for new fleas that jump on them. And that is going to be where our problem is coming from, is that we are killing the fleas we see, but we're not killing the fleas we don't see. What I would recommend for your cats is to get them started on one of the monthly flea preventatives, things like Celerid, which is one that we have here at Spay Neuter Network, and it will take care of fleas and mites and some GI parasites, and you give it to them once a month, and it will not only will it kill fleas that are on them, but any fleas that jump on them will also die and will also be unable to lay eggs that will hatch. So we're able to hit the flea at all parts of its life cycle, when it's from the time that it's an adult to the time where they're laying their eggs. And that will get our flea issue under control. If we have a flea infestation, if we have fleas in our environment, expect it to take a good 3 months before you don't see any fleas at all, because that's how long it will take for all of the fleas and all of the eggs to go through their life cycles and hatch and get exposed and die. So treat consistently with a monthly flea control product that will control those fleas and prevent them from being able to breed, and then we will be able to get our flea control our flea problem under control. So let's start with a monthly preventative for them, and we have those at here at Spay Neuter Network, and we would be happy to see your cats and get them started on a program for you. Okay, here is a question that has come in right now. My cat is losing her fur on her spine closer to her tail. Could you please tell me what could be the reason? Okay, that is a great question without a really good clear-cut answer. So, things that can make cats lose their hair, especially close to the tail. Let's see, this is a female cat, so there's an issue with male cats where they have a little oil gland back there that will cause them to lose some of their hair around their tail, but we don't typically see that with the female cats. So some things to think about are, is she excessively grooming herself for some reason? So do we see her chewing and pulling on the fur close to her tail? If so, what is bothering her? What's irritating her? Or is this just sort of a strange behavioral thing that we need to address? Before I become too excited about hair loss issues in a dog or a cat, the first thing that I ask is, are we on some kind of good flea control? Because flea control will is the number one reason in Texas why animals have skin and hair issues. So let's make sure that we're on some kind of flea control first before we start investigating things that are more complicated. As I was saying, we can get you a monthly flea control option here at Spay Neuter Network and get that under control and rule that out as a problem. Other things that could potentially do that would be something like ringworm. You don't typically see it in that area, but you could. And then another reason would be if this is an older pet, sometimes if they have some arthritis pain, that will present as pain back there kind of by their tail, and they will excessively groom back there because it hurts. So my advice would be to first let's get started on a good flea control program if we are not on one, and if that does not start to resolve the problem, I would take her to your veterinarian to get checked out and see if we have some other underlying issue that could be causing her some pain or discomfort back there. That is a very good question. Okay, another question. Frank writes in to ask, is anesthesia bad for cats? We have had lots of cat questions today. That is excellent. Frank says that his cat has tartar buildup. He cleaned it last year, but it's coming back. She doesn't let me brush her teeth at all. I want to take her to the vet for a dental cleaning, but I'm worried because of the anesthesia. She has undergone a surgery to spay and one dental cleaning before. The anesthesia makes her anxious and tired. I fear putting her under anesthesia so many times might cause harm. She's almost 12 years old now, but in great health. Is annual dental cleaning with anesthesia too much on her? So the short answer to your question is no, it is not too much on her. To expand on that, something that I always say, and I remind myself of this sometimes on an almost daily basis, is that getting older is not a disease. There's nothing wrong with getting older. That's a good thing. However, getting older does make more diseases likely to occur. So prior to getting our dental cleaning, we definitely would want to check some blood work in your 12-year-old cat and make sure that everything looked good beforehand. As long as we have good organ function and don't see anything abnormal going on with our kidneys or our liver, we should be fine. If we do see some abnormalities there, then we'll want to talk about that and decide what the best course of action is. Dental disease is a common thing in cats and in dogs, and it can cause a lot of problems if left uncontrolled. So it would definitely be well worth having your cat's teeth cleaned as long as everything looks good on our blood work. And As far as the anesthesia goes, yes, anesthesia makes you do weird things for a few hours, sometimes up to 24 hours. But after that, we typically bounce back just fine. Pets will bounce back just fine, and we just need to make sure we have a nice, quiet, cool place to rest and not have a whole lot of excitement while we shake off all of those anesthetic drugs and get back to our regular cat lives. Excellent question. I definitely recommend yearly dental cleanings. So many cats don't want you touching their teeth and brushing their teeth. I totally get that. But getting those teeth cleaned, and then you can talk with your veterinarian. There are numerous dental treats that are available now for cats that will help scrape off plaque and tartar and help maintain their cleanliness of their teeth between those annual dental cleanings. Great question. Okay, here is the final question that I had come in prior to getting started today. And Cheryl writes in to say, "Hi, I just adopted a 2-month-old kitten yesterday, and I just wanted to ask if he did come back positive for anything on a fecal test, how long would I need to have my cat and my kitten separated for?" Great question. Congratulations on your new kitten. It's an exciting time, and you're going to see what kind of cat this kitten grows up to be. So if we have a positive fecal test, hopefully we were dewormed at that same time with an appropriate dewormer to kill any of the GI parasites that we see. Now, that being said, there will probably be some eggs that are still passed in the feces for a few days. You don't necessarily have to keep your cat and kitten separated because they're going to be doing things like sharing litter boxes and things like that. But you do want to have your cat and your kitten dewormed about 2 weeks from the time that you brought the new kitten in, so that we're able to stop any GI parasite life cycles in their tracks and keep everybody healthy. So I would say that you don't have to keep them separated, but you are going to want to deworm both of them in about 2 more weeks, and that should keep everyone in good shape. While we are wrapping up here, let me point out that February is Spay Neuter Awareness Month. I think that's great because it's Valentine's Day and it's warming up, and cats and dogs are looking to make puppies and kittens during this time of the year now that it's starting to warm up a little bit. And World Spay Day is February 24th, and that is a day that's recognized internationally where the importance of having our pets spayed and neutered is emphasized. As we count down those days to World Spay Day, we are incredibly grateful to be a part of a mission that helps pets, families, and communities every single day. We pride ourselves on being able to provide spay, neuter, and wellness services at Spay Neuter Network to as many people as possible, and being part of that and being able to do that is just a incredibly gratifying and heartwarming feeling. And thank you to all of you for helping us with that by bringing your pets to see us. And then thank you as well to all of our hardworking staff and volunteers that help us to make that mission a reality. It would be great if you are able to donate today on our website to help stop the cycle of pet overpopulation and change an individual pet's future. You can find the ability to donate to us on our webpage at spayneuternet.org, and anything that you do is a huge help. We also have some events coming up. You will be able to get all of the details about this on our Facebook event page and also on our web page. We have some upcoming low-cost vaccine clinics, and the next one coming up will be this next Wednesday on February 11 at 6 p.m. at Green Pet in Dallas. So if you are in Dallas and it's time for your pet to get vaccinated, this would be a great time to do it. We have free rabies and free FVRCP and distemper parvo vaccines for dogs and cats at our low-cost clinics, and then all of our other vaccines are at a very low price. and that would be a great opportunity to take advantage of. Thank you so much today for joining us on Ask the Vet Live, presented by Good Charlie Energy. Be sure to check out Good Charlie Energy's website through the link here at the bottom of our Facebook page, and also you will find links to our page. Please leave your comments and questions for when we get together next time. We'll be happy to take a look at those and answer those. And please check out our main webpage for all of the events happening in your community and ways that you are able to help Spay Neuter Network help people and pets. Thank you very much. Have a great rest of the day.